Hello everyone, my name is Caitlin Terrell, and today I will be presenting on birth to 6 months of age, and my group partner was Christina White, and we decided that we were going to divide up the presentation in a way that she would talk about 1 month, 3 months, and 5 months, and I will be talking about 2 months, 4 months, and 6 months. And also, just so you know, I will be flipping through the slides. If you see any that go by pretty fast, those are just the slides that she will be presenting. So first I want to talk about typical expressive language. A child who is 2 months old will begin to smile at people. They will try to look at their parent. Once they are 4 months old, they like to play with people. They will smile spontaneously. They will cry when playing stops. And they will copy movements and facial expressions, especially of their parents. By 6 months of age, they respond to the emotion of others, and they like to play with others, especially their parents once again. Okay. The typical receptive language of these different ages. By 2 months, they should be able to turn their head towards a sound. By 4 months, they should be able to copy sounds that they hear. By 6 months, they should be able to respond by making sounds and respond to their own name. When talking about the speech development at 2 months, they should be cooing and making gurgling sounds. By 4 months, they will begin babbling and babbling with expression. And they will also begin to cry in different ways to show different feelings such as hunger, pain, or tiredness. By 6 months, they will start to string vowels together while babbling, such as A, E, I, and different variations. And they will start to participate in turn-taking with their parent. And then later they will begin to start jabbering with sounds like and buh and begin using different consonants. Going a little bit further into the typical speech development, I found some research on one of my ASHA articles, and according to authors Ramsell, Huddock, Warlimont, Foss, and Perry, from around 1 to 4 months of age, infants enter the primitive articulation stage, also known as the coo and goo stage, of vocal development. In this stage, cooing or gooing sounds are produced during comfortable states. The productions are said to contain consonant-like and vowel-like segments. The consonants are not clearly articulated, and the vowels are, again, not fully resonant within the oral, nasal, and pharyngeal cavities. They continue to state that from around 3 to 8 months of age, infants produce vocal play in the expansion stage with extreme variations in loudness, like yells and whispers, and pitch, such as squeals and growls. According to authors Rob, Yazvarde, Schulter, Voigt, Shahada Deiler, and Wormke, any vocalization at any age produced by a neonate infant or child is an essential constituent of his or her individual discoveries in acquiring spoken language. When talking about vocal quality for these ages, according to authors Gregory, Tabane, and Robb, most infants within their first 6 months use non-metal productions, which are further explained in saying, non-metal productions include vocalizations with harsh or creaky phonation, those produced with formant structures that are unstable, or those with widely fluctuating fundamental frequency. They can also include vocalizations produced with intermittent voicing, or those deemed as vegetative, such as wheezes, sneezes, coughs, hiccups, or clicks. Now getting into motor and cognitive milestones. At 2 months, a child will start paying attention to faces. They'll begin following things with their eyes. They start to become more curious. They will cry if an activity does not change. They will bring things to their mouth. They can hold their head up when pushing off their stomach and make smoother movements with their arms and legs. And then transitioning to 4 months, they can recognize familiar people and things from a distance. They can follow things with their eyes from side to side. They will reach for objects with one hand and start forming hand-eye coordination. They can push on a hard surface with their legs when being held. They respond to affection. They can roll over in both directions and they can begin to sit without support. When standing supported, they may use their legs to bounce, and they'll begin rocking back and forth and may also start crawling, which can sometimes be backwards before forwards. Continuing on to 6 months, a child will watch objects fall and follow its path. They can play peekaboo. They can look for objects that you may hide. They'll be putting objects in their mouth. They can easily move objects from one hand to the other. They can pick up small objects between the index finger and the thumb, which is working on the fine motor skills. They can stand with support. They can get themselves into a sitting position. They usually pull to stand up, and they can crawl. And now I have a video, and I just thought this was a good video to go into a little bit further detail of the 2-month-old milestones. And I just thought that was a really good video to summarize the 2-month stage. And my partner Christina, she will be looking at the end of the birth to 6 months with a 6-month-old video. And that pretty much wraps things up. And now I have our references listed, which include the CDC, where a lot of the information came from, as well as the 5 ASHA articles that were cited throughout and the videos that we used. Thank you so much for listening.